You are the nurse taking care of a patient who is started on trimethoprim, sulfamethoxazole for a urinary tract infection. When counseling the patient about possible side effects, you offer which of the following statements? A. Do not take fish oil while taking trimethoprim, sulfamethoxazole. B. Do not eat bananas while taking trimethoprim, sulfamethoxazole. C. If you notice a skin rash, please call your physician immediately, and if nobody answers, go to the nearest emergency department. D. Avoid contact sports while taking trimethoprim, sulfamethoxazole. E. Do not operative heavy machinery or motor vehicles while taking trimethoprim, sulfamethoxazole. The answer is C. If you notice a skin rash, please call your physician immediately, and if nobody answers, go to the nearest emergency department. A rare, but potentially fatal side effect of trimethoprim, sulfamethoxazole is a severe skin rash called Stevens-Johnson syndrome. This rash results in death of the cells of the epidermal skin layer, and results in their separation from the dermal skin layer. It occurs for a handful of reasons, but most commonly is a hypersensitivity reaction in the skin and mucous membranes to medications, such as trimethoprim, sulfamethoxazole or antiepileptics. It is a true medical emergency. Thus, if any patient taking trimethoprim, sulfamethoxazole experiences a new skin rash, they should call their prescribing physician immediately, and if no one answers, they should proceed to the nearest emergency room. Neither fish oil, nor banana consumption are contraindicated in patients taking trimethoprim, sulfamethoxazole. Trimethoprim, sulfamethoxazole does not typically have any appreciable effects on one's ability to operate heavy machinery, motor vehicles, or play contact sports. Which of the following heart medications is most likely to cause a chronic dry cough? A. Hydrochlorothiazide. B. Nolol. C. Amlodipine. D. Enalapril. E. Losartan. The answer is D. Enalapril is an ACE, angiotensin-converting enzyme, inhibitor. One of the most commonly reported side effects of ACE inhibitor use is a chronic dry cough. This is likely due to the medication's inhibition of kininase 2, a CE, which results in a buildup of kinins in the respiratory tract. None of the other medications listed are associated with persistent cough. What is the antidote for overdose of warfarin? A. Heparin. B. Vitamin K. C. Protamine sulfate. D. IV magnesium. The answer is D. Vitamin K. The proper antidote for overdose of warfarin is vitamin K. Heparin will not reverse the effects of too much warfarin, it would only aggravate the problem. Protamine sulfate is the antidote for overdose of heparin. IV magnesium may be used to antidote digoxin if digobind is unavailable. Which of the following is an adverse effect in the client being treated for hypertension with enalapril? A. Nausea. B. Insomnia. C. Swelling of the tongue. D. Dry cough. The answer is C. Swelling of the tongue. A swelling of the tongue indicates that a client may be allergic to enalapril. Other indicators include rash, hives, itching, difficulty breathing, and tightness in the chest. Which of the following medications is a non-selective beta-adrenoceptor and alpha-adrenergic blocker? A. Carvedilol. B. Lisinopril. C. Amiodarone. D. Clonidine. The answer is A. Carvedilol. Carvedilol is a non-selective beta-adrenoceptor and alpha-adrenergic blocker. Lisinopril is an ACE, angiotensin-converting enzyme, inhibitor. Clonidine is an alpha-adrenergic agonist, and amiodarone is a sodium channel blocker. You are a nurse working on an inpatient medicine floor. One of your patients is advised to discuss starting gamfibrozil, a fibrate medication, after he is discharged. Which of the following best describes the mechanism of action of gamfibrozil? A. Vitamin K-dependent clotting factor synthesis inhibition. B. HMG-CoA reductase inhibition. C. Alpha-adrenergic inhibition. D. Beta-adrenergic inhibition. E. Peroxisoproliferator activated receptor, PPAR, activation. The answer is E. Peroxisoproliferator activated receptor, PPAR, activation. This is the accurate mechanism of action for fibrate medications, such as gamfibrozil. Fibrates are commonly used medications used to treat high cholesterol, as well as a number of other metabolic abnormalities in patients. Fibrates have the relatively unique property of lowering LDL, the bad cholesterol, increasing HDL, the good cholesterol, and lowering triglycerides, making them a popular choice when administered either alone, or with statin medications for patients with hypercholesterolemia. HMG-CoA reductase inhibition is the mechanism of action of statins. Vitamin K-dependent clotting factor synthesis inhibition is the mechanism of action of warfarin. Alpha-adrenergic inhibition is the mechanism of action of phenoxybenzamin, among other medications. Beta-adrenergic inhibition is the mechanism of action of propranolol, among other medications, when used with statins. There is a tendency for myositis and rhabdomyolysis. Hence it is advised that patients be advised of this adverse effect and asked to report promptly any muscle pain, weakness or tenderness, particularly if accompanied by fever, malaise or dark urine. Rhabdomyolysis is characterized by plasma creatinine kinase greater than 20,000 IU per L, myoglobinuria and extreme muscular pain, occurs in about 1 in 250,000 patients and is commoner in females, the elderly. Hypothyroidism. If CK is significantly elevated, greater than 5 times the ULN, or if myopathy is suspected, then treatment should be stopped, while the patient is monitored for muscular symptoms and cardiovascular risk. You are the nurse taking care of a patient hospitalized for a deep vein thrombosis. You are reviewing his discharge medications, and counsel him about the benefits and risks associated with apixaban. Which of the following is a major possible adverse effect associated with apixaban? A. Thrombosis. B. Constipation. C. Ischemic stroke. D. Myocardial infarction. E. Bleeding. The answer is E. Bleeding. Apixaban is a novel anticoagulant medication that functions by directly inhibiting factors in the clotting cascade. You can remember this mechanism of action by noting the letters 10A. In apixaban. Apixaban is used with increasing frequency now in the treatment of deep vein thrombosis, pulmonary embolism, and atrial fibrillation. A very serious potential adverse effect of apixaban though is that since it is an anticoagulant agent, it can predispose to serious bleeding events. Furthermore, one of the biggest dangers of apixaban is that there is no readily available antidote for it yet, and as such if a bleeding event occurs, there is no simple way to reverse it, as there is with other anticoagulants like warfarin or heparin. Thrombosis, myocardial infarction, and ischemic stroke are all typically thrombotic, for example clot-related, issues. Apixaban may be used in the treatment of conditions associated with clotting, but is not known to cause clots, as it is an anticoagulant. Apixaban has no known association with bowel movement frequency. You are a nurse taking care of a patient during a rapid response call. The patient is bradycardic and you are asked to administer atropine. Which of the following best describes the mechanism of action of atropine? A. Beta-adrenergic blocker. B. Muscarinic acetylcholine receptor agonist. C. Muscarinic acetylcholine receptor antagonist. D. Alpha-adrenergic blocker. E. Monoaminoxidase inhibitor. The answer is C. Muscarinic acetylcholine receptor antagonist. Atropine is an anticholinergic medication used for a number of reasons, including to treat bradycardia, various nerve agent poisonings, and intraoperatively at times to diminish the amount of saliva generated. Typical anticholinergic medication side effects can be associated with atropine including pupil dilation, urine retention, dry mouth, constipation, and tachycardia. Muscarinic acetylcholine receptor agonist is incorrect as this is the opposite of how atropine works. Beta-adrenergic blocker is incorrect. This class of medications would actually serve to decrease heart rate, which would be highly dangerous in a patient whose reason for intervention is bradycardia. Neither alpha-adrenergic blockade nor monoaminoxidase inhibition describes the mechanism of action of atropine. You are the nurse taking care of a 78-year-old female who is in atrial fibrillation with rapid ventricular response. She is started on metoprolol and diltiazem. Which of the following best describes the mechanism of diltiazem? A. Mu opioid receptor agonist. B. Calcium channel blocker. C. Beta adrenergic blocker. D. Alpha adrenergic blocker. E. Mu opioid receptor antagonist. The answer is B. Calcium channel blocker. Diltiazem, which is more specifically a non-dihydropyridine calcium channel blocker, is a commonly given medication that functions to dilate both coronary and peripheral vessels, with a negligible reflex adrenergic response. It also is useful in reducing cardiac contractility, having negative inotropy, chronotropy, and dromotropy characteristics. The other choices are incorrect. Beta adrenergic blocker is the mechanism of action of metoprolol. Alpha adrenergic blocker is the mechanism of action of doxycycline. Mu opioid receptor agonist is the mechanism of action of morphine. Mu opioid receptor antagonist is the mechanism of action of naloxone. The answer is A. Taper the medication to avoid discontinuation syndrome. Clients taking paroxetine may experience withdrawal and continuation syndrome. To minimize symptoms, taper the medication over a period of 3 or more weeks. A client has been taking daily doses of paroxetine for 6 months and has asked for an information with the nurse about going off the medication. What should the nurse emphasize in the information session? A. Taper the medication to avoid discontinuation syndrome. B. Advise the patient of probable weight gain after going off the medication. C. Stop taking the medication immediately. Increase physical activity level for 2-3 weeks to counteract side effects. D. Urge the client to continue taking the medication until he consults a psychotherapist. What type of antidepressant is fluoxetine? A. Monoamine oxidase inhibitors, MAOI. B. Norepinephrine reuptake inhibitor, NRI. C. Selective serotonin reuptake inhibitor, SSRI. D. Tetracyclic antidepressant. The answer is C. Selective serotonin reuptake inhibitor, SSRI. Fluoxetine is an example of a selective serotonin reuptake inhibitor, SSRI. SSRIs limit the amount of serotonin that the presynaptic cell that secreted it can reuptake. This increases the time and amount that serotonin is in the synaptic cleft and bound to postsynaptic receptors, leading to antidepressant properties. The other drugs are all antidepressants, but are sold under other names. What drug class is clomipramine? A. Serotonin modulator and stimulator, SMS. B. Selective serotonin reuptake inhibitor, SSRI. C. Monoamine oxidase inhibitor, MAOI. D. Tricyclic antidepressant. The answer is D. Tricyclic antidepressant. Clomipramine is a tricyclic antidepressant. Drugs in this class function primarily by blocking serotonin and norepinephrine transporters, resulting in an increase in the levels of these neurotransmitters in the synapse, and thus an increase in their effects due to staying bound to postsynaptic receptors for longer. What class of drug is trazodone? A. Tricyclic antidepressant. B. Tetracyclic antidepressant. C. Serotonin antagonist and reuptake inhibitor, SARI. D. Norepinephrine reuptake inhibitor, NRI. The answer is C. Serotonin antagonist and reuptake inhibitor, SARI. Trazodone is a serotonin antagonist and reuptake inhibitor. These drugs work by increasing the release and inhibiting the reuptake of serotonin in the synaptic space, thus increasing the effect of serotonin. Aripiprazole is what class of drug? A. Selective serotonin reuptake inhibitor, SSRI. B. Atypical antipsychotic. C. Serotonin norepinephrine reuptake inhibitor, SNRI. D. Serotonin modulator and stimulator, SMS. The answer is B. Atypical antipsychotic. Aripiprazole is an atypical antipsychotic. It acts as a partial dopamine agonist and an agonist to multiple 5-HT, serotonin, receptors. What class of drug is quetiapine? A. Serotonin antagonist and reuptake inhibitor, SARI. B. Norepinephrine reuptake inhibitor. C. Tricyclic antidepressant. D. Atypical antipsychotic. The answer is D. Atypical antipsychotic. Quetiapine is classified as an atypical antipsychotic. Quetiapine is a powerful antihistamine and has pharmacological action at many receptor types. It is a serotonin, dopamine, and adrenergic antagonist. Which of the following antidepressants is also used for smoking cessation? A. Bupropion. B. Venlafaxine. C. Amitriptyline. D. bus by your own? The answer is A. Bupropion. Bupropion is an antidepressant used for smoking cessation. None of the other medications listed are used for smoking cessation. Sertraline, paroxetine, and citalopram are all classified as what type of antidepressant? A. Selective serotonin reuptake inhibitors, SSRIs. B. Serotonin modulator and stimulators, SMSs. C. Monoaminoxidase inhibitors, MAOIs. D. Serotonin norepinephrine reuptake inhibitors, SNRIs. The answer is A. Selective serotonin reuptake inhibitors, SSRIs. Sertraline, paroxetine, and citalopram are all selective serotonin reuptake inhibitors, SSRIs. This class of drug works by blocking serotonin reuptake in the synapse, thus increasing postsynaptic serotonin stimulation. They are one of the most widely used class of antidepressants in the United States and many parts of the world. Zolpidem belongs in what drug class? A. Non-benzodiazepine hypnotic. B. Benzodiazepine. C. Selective serotonin reuptake inhibitor, SSRI. D. Orexin antagonist. The answer is non-benzodiazepine hypnotic. Zolpidem is a short-acting non-benzodiazepine hypnotic. Its actions are similar to benzodiazepine drugs in that it stimulates GABA receptors at the same location as benzodiazepines. It is used in insomnia for initiating sleep, though its short half-life, 3 hours, means it is not generally considered effective for maintaining sleep. All of the following are common anticonvulsants except dash. A. Carbamazepine. B. Lamotrigine. C. Valproate. D. Risperidone. The answer is D. Risperidone. All of the answers given are common anticonvulsant medications except risperidone, which is a second-generation, atypical antipsychotic used in schizophrenia and bipolar disorder. Lamotrigine carries a black box warning about what side effect? A. Dress syndrome, drug reaction, rash with eosinophilia and systemic symptoms. B. Stevens-Johnson syndrome. C. Aseptic meningitis. D. All of these. The answer is D. All of these. Lamotrigine carries a black box warning about the following side effects: Stevens-Johnson syndrome, toxic epidermal necrolysis, dress syndrome, drug reaction, rash with eosinophilia and systemic symptoms, aseptic meningitis. Phenelzin is what class of drug? A. Monominoxidase inhibitor, MAOI. B. Tricyclic antidepressant. C. Alpha-adrenergic agonist. D. Narcotic. The answer is A. Monominoxidase inhibitor, MAOI. Phenelzin is a monominoxidase inhibitor, MAOI. Drugs in this class work by inhibition of monominoxidase enzymes, the enzymes responsible for the breakdown of serotonin, dopamine, and adrenaline. What class of drugs is diazepam? A. Non-benzodiazepine sedative. B. Benzodiazepine. C. Methaqualone analog. D. Barbiturate. The answer is B. Benzodiazepine. Diazepam is a benzodiazepine. This class of drugs works by potentiating the effects of GABA, our primary inhibitory neurotransmitter, at the GABA-A receptor. Bromocriptine belongs to what class of drug? A. Peripheral dopamine decarboxylase inhibitor. B. Anxiolytic. C. Anticholinergic. D. Dopamine agonist. The answer is D. Dopamine agonist. Bromocriptine is a dopamine agonist used in the treatment for Parkinson's disease, pituitary tumors, and type 2 diabetes. A patient taking haloperidol complains of abnormal, unintentional movements of his tongue and face. The nurse knows that the patient is experiencing which of the following side effects of haloperidol? A. Convulsions and seizures. B. Neuroleptic malignant syndrome. C. Increased anxiety. D. Tardive dyskinesia. E. Dizziness and weakness. The answer is D. Tardive dyskinesia. All of the listed options are side effects of haloperidol, but tardive dyskinesia is the only one that manifests with involuntary, dyskinetic movements in their face, lips, tongue, trunk, and extremities. Tardive dyskinesia more frequently occurs among elderly female patients taking long-term dopamine antagonist medications. Dizziness, weakness, convulsions, seizures, and anxiety are also side effects of haloperidol. Neuroleptic malignant syndrome presents with fever and high, unstable blood pressure, muscle cramps and tremors, altered mental status, such as delirium, agitation, or a coma.